Welcome to our third session, Mobilizing for a National Response, featuring Professor Juliette Kayyem of the Harvard Kennedy School. Our moderator is HBS and HKS Professor Dutch Leonard. Please note that a recording of this session will be made available to a broader public audience. If during Q&A you're called on to pose a question, your name and voice will be part of that recording. If you have a tech problem, the best thing to do is log out and then log back in. We are turning on the chat function for this session, so you can have substantive conversations among yourselves and with us via chat. We may occasionally pull in somebody from the chat stream to pose a question. Over to you, Dutch.
Thank you so much, Andy, and good morning and welcome to all of you. I'm using this background. I'm actually not standing in a Harvard Business School classroom, but I thought you all might like to be welcomed back to the physical space that we all know and love. So good morning to all of you. As Andy said, I'm Dutch Leonard, and it's a huge pleasure to be with you all. I wish we were in better circumstances, and to have a chance to work with one of my very favorite colleagues from the Harvard Kennedy School, Juliette Kayyem. Juliette and I have worked together a lot in the Kennedy School's crisis management programs, and we never thought we were going to be living through an event like this as we are, but it's nice at least to have a chance to think about it and talk about it with all of you. I also want to congratulate the organizers today. We've had two previous discussions this morning, which were just terrific and which perfectly set up what we're going to be talking about here. What we want to focus on is the question of response, national response, individual response, firm response. To say just a few words about that before we start, let me observe that the challenge of response is much broader than just thinking about COVID-19 as a medical event. And that I thought was really wonderful in the previous session where Dr. Shisha laid out the fact that obviously there's a whole set of medical issues here, but the crisis goes far beyond that. And that's what we want to talk about in this session. It's the broader aspects of response, the broader aspects of wrapping our arms around the whole enterprise. Now, as Juliette and I teach in our courses on crisis management, any major emergency event is a volcano of issues, questions, decisions that have to be made, tasks that have to be undertaken. In most events, we're familiar with those tasks. So in a hurricane, you know pretty much what those things are going to be, what the questions are, what the issues are going to be. But in a novel event like COVID-19, you have a whole set of questions that you never saw before. And so events like this, what we call true crisis events, confront us with a very daunting question and confront leaders with a daunting question, which is, what do we do when no one knows what to do? Now, there's only one possible answer to that. Someone has to figure it out. Someone has to wrap their arms around the event as a whole, try to understand the event, and then engage in rapid, agile, iterative problem solving over and over and over again. Now, they have to do that under stress and embedded in fear. And most individuals are not intrinsically good at that or ready to do that. And most organizations are not intrinsically ready to do that. So the challenge is that when we have that kind of level of stress and not everyone's good at it, where do we find the someones who are good at it? One of those someones, one of those people who has regularly had to help us try to figure out what to do when no one knew what to do, is Juliette Kayyem, our guest today. Now, you've seen her on CNN, actually much as she appears now, in that same room in her house in Cambridge. You've read about her in The Atlantic. You've read her commentary in The Atlantic and in other places. Among other major involvements that she's had in events that you would remember, Juliette was the Assistant Secretary for Intergovernmental Affairs at the Department of Homeland Security during the H1N1 event, a precursor to this event, and also during the Deepwater Horizon oil spill. So she's regularly had to try to help us figure out what to do when no one knew what to do. Now, chat is on, so we're going to ask you to be restrained in that and to focus your chat on the issues that we're talking about here. But just to give commentary or reactions, you're welcome to use chat to do that. Juliette, it's great that you're with us today. So glad to have you with us. Let's start with the oil spill just for a moment. Okay. I've heard you say on a number of occasions that it was the spill itself, and then there was the event and the crisis beyond that. Say a little bit more about what you mean by that. What's the distinction and why does that matter?
Okay, well, thank you. First of all, thank you to everyone at the business school for having me, and Dutch for us doing another event together, which is, I guess that's the silver lining of everything going on. And thank you all for tuning in to what Dutch and I are going to talk about today. So my background, of course, is, as Dutch said, is in crisis management and homeland security. So I think about how governance structures within our homeland really impact our both our capabilities and responsibilities around crisis response and disaster management. I've also been fortunate to work in state government as Deval Patrick's Homeland Security Advisor, and then federal government. So this federalism debate that you're seeing played out right now is very familiar to me. Who's in charge and who gets to do what between mayors, governors, and presidents. And that played out really also in the BP oil spill. I bet you if I polled all of you watching, you would say, oh, the BP oil spill, why would she promote that? That was horrible. That's probably true in the sense of a narrative, but it's not true in the sense of the response. So what Dutch was picking up on is that every crisis has its response, right? Which is the saving of lives, the minimizing of property damage, the minimizing of environmental damage, and then it has a narrative. That narrative may be very, very different than the response. So if you ask me, was the BP oil spill response a success? I would say, given everything going on, because I live in the world where bad things have already happened, yes, an ocean was saved. Right? Less oil hit shore. The industries were back up and running within 3 months, right? You don't know that because it was madness. You know, the narrative was madness. And what that narrative is, we have to be conscious of when we're fighting a crisis, right? When we are in the middle of a crisis. For the BP oil spill, that narrative is probably one that many of you forget. It was a narrative about the future of the oil industry. This was before LNG came on, or natural gas came on board, and the future of offshore drilling. It was about the legacy of Hurricane Katrina. These were the same 5 states that had been impacted by Katrina and had felt abandoned by the federal government. It was about the future of well, I guess it was about politics, right? So there were 5 Republican governors, 1 Democratic president. 3 of those governors would run against the president in his reelect, and all of those formed this cacophony of madness. But the operations still happened, and they were successful because in crisis management, you don't judge things by whether something bad has happened. You're already there, right? You're already in response, right? And you can blame, and you can have commissions, and you can figure out what went wrong. Your measure of success is, did less oil hit shore than it otherwise would have because of the government's efforts, right? And so that's how I think about, today. What's my number, right? Is 100,000 good? Well, if I entered this thinking 1.2 million, yes, that's a good response. It's not good in any, existential way, but that's how we have to think about how these narratives interact with the response.
So Juliette, I think that's a really interesting place for us to start into the COVID-19 event. Yeah. Part of what you're saying is that, it's hard to know what the baseline is or what the metrics are or what you're measuring against if we've never been through an event like this before.
Right. That's exactly right. So you begin both sort of operationally in terms of where are we in the response, and then where are we going, right? Which we can talk about as well. So so what I do when I teach and advise, Dutch and I are involved with the mayor's program, as well as governors and CEOs and others I advise, is I try to, my yoga is I put method to chaos. And I thought that this would be helpful for all of you, and I'll leave it behind, which is when, about 2 weeks into this, I teach this stuff and my brain was just on fire. I could not figure out sort of where were we, and it was important for me to be able to ground people I advise and the students I teach, and sort of where are we. So the bad news is, coronavirus is new. The good news is that crisis management is not. And so what I'm trying to do for all of you is try to position us in sort of where we are. So every crisis has 5 stages. So you have protection and prevention, which is what we call left of boom. It's before the bad thing happens, right? So you could, you try to protect society from bad things happening, which we would have benefited from a strong identification system, transparency from China, all of those things. And that with coronavirus is before December 2019, right? That all of that would have been, we have a system that's prepared for a potential pandemic. Then you have the prevention stage, which for us, this is US based, is between December 2019 and February 2020, which has now been described, as most of you have probably read, as the squander time, right? In other words, we are trying to prevent the US from suffering a 50-state crisis, right? A 50-state pandemic. And here's all the things that we might have done to prevent it, right? We might have had better testing kits, better notification systems, and we would have prepared the public and employees. That didn't happen. And then we're at the boom stage, which is actually not a stage, it's just the moment of crisis. And as Dutch was saying earlier, when you have a hurricane or earthquake, it happens, it's done, and it's easy to mobilize. Your response is super easy because there's damage and bodies and all, it's like you don't question when you activate. The problem with a slow roll crisis like a pandemic is, of course, there's no single moment of clarity. And so what you saw in our homeland was, the San Francisco mayor who's going to, emerge as the hero or heroine in all of this, London Bree, decides to activate early, right? And she's there on lockdown, 2 weeks before most other places. And so you have this activation challenge, and that meant you had a disjointed response, a White House in denial that does not take ownership of sort of a national strategy. And then that's when you see the emergence of the mayors and governors. I'll just quickly go to response because I think it's helpful. This is where we are. And look where we are on response. We're at the beginning of response, people. It's hard to accept, but most places have not flattened the curve as we've now come to understand it. But we are mobilizing on a personal, public sector, and institutional level. The personal, of course, is we need to plan for long-term social distancing. It's the washing of the hands, the masks, everything, stay at home. There's a certain amount of shaming involved, that you tell your parents if they're a certain age to stay home. Then you have the public sector response, which has been probably the one that's been the most challenging right now. The surging of resources is not happening as we know it. You'll have social distancing restrictions that are different by jurisdiction. And then, of course, the economic protections that we need to put in place because so many people are damaged. And I view that as part of the operational response. I don't view the economy is separate from society. It is part of it. So it's part of our operational response. And then finally, the institutional. And this is where it gets interesting. We're at an institution now, and they made a decision. I'm sure it was jarring for many of you, that we're out of here. We're out of Harvard. We got to get to essential and non-essential functions and think about continuity of operations. We are at the beginning of this, right? Even countries that have overcome the curve, like Italy, are still in lockdown. Those that thought they could avoid it, like Japan, are now under lockdown. This talk of opening up is important because you need an eyes on the prize, but it's about metrics. It's not about a date. So I have here March 2020 until a question mark. And governors are pushing that envelope, people. I mean, if you heard Charlie Baker, he refuses to answer it here in Massachusetts. I think we're going to get into adaptive recovery later, so for me to talk about, and then basically the next two are recovery and resiliency. So this is just a way for you all to think about, well, where am I? Because you're part of this, right? And what are the challenges? And I guess I'll just end with this chart. We're going to come back to adaptive recovery. Is a crisis hits a nation. I often say a crisis hits a nation as it is, not as we would like it to be. It's worth remembering the challenges our nation has from healthcare and workers' rights and the gig economy and racism that we're seeing against the Asian community. Those unfortunately tend to get exacerbated in the midst of a crisis. but often get resolved better after. But we are in the rough spell stage where everything that was, income inequality that was wrong continues to be wrong,
So when we see that in so many different ways in events like this, the accumulation of prior injustice, for example, access to healthcare, plays out again here. And so we're all grappling with a bunch of those. But thank you for that sort of overview of the fact that there are stages, that there is a life cycle to this process, there is an end game. And we'll come back a little bit more to the resilience question a little bit later. But Juliette, one of the things you just said was, this is a 50-state disaster. And I've heard you say before, this is in a way the first 50-state natural disaster that the United States has faced, at least in a very long time. What do you mean by that? And what are the implications of that?
So it's great. So I've been doing, as you said, I've been doing these columns for the Atlantic and just trying to prepare readers for what's next. And it was just clear, I've been involved with pandemic planning. There are plans. They had been tested and exercised. So what I was saying is not prescient. It's just the nature of a pandemic. And so once it was clear that we had widespread community spread. So this is, that we only had one tool left, right? Which is social distancing. That's all we had left. That's it, right? Nothing left. It also became clear that community spread was going to be across the United States. And so that, as I often say in my Homeland Security class, I also teach a Homeland Security class, security is the easy part. It's the homeland that's complicated. And that is true here. We have states, cities, but we also have territories and tribal authorities. We have a complicated governance system in this country that one could argue makes us built unsafe, right? I mean, in other words, you don't have chain of command. You have what we call unity of effort, and it may be that federalism and the 10th Amendment of the U.S. Constitution, which reserves public safety, public health, and most quarantine authorities to the governors, that sometimes delegated to mayors, all of that diversity of governance may actually end up helping us because of the lack of sort of national standards at this stage. But what I mean by 50 state is both good and, or not good, is both descriptive and then challenging. So the descriptive part is never, just so you know what a big deal this is, not that I have to tell you, is that all 50 states are operationally activated. So we've had disasters here that impact all of us, 9/11, Hurricane Katrina, but their emergency management functions weren't all activated. And so that means the demands on each state are make them somewhat insular, but it also means the demands on the federal government are greater. The second part, which is more challenging, is, and Dutch certainly knows this, that the entire Homeland Security apparatus is based on a three-part scheme. Local execution, so think about Boston, and the sort of tactical levels. State coordination, right? Because then you have Governor Baker thinking, or Governor Cuomo thinking through what each part of the state needs and how are you thinking about it and what rules and guidelines do you want, and then federal support when more is needed. For the most part, most disasters work with just a state. There's a flooding, a state can deal with it. But in some bad disasters, you had mentioned the wildfires, California will say, look, we need, Massachusetts, we need 40 more firefighters. Can you send 40 more firefighters over? And we have this really intricate mutual aid program that, that California pays for Massachusetts firefighters to go over. And it's done without even thinking, right? It's just a sort of pay and play structure and plug and play. The Massachusetts firefighters know what to do in California because we have a national system of incident command that that basically they are able to plug into. No state is sharing. They are coordinating, but it would be very hard until a state knew that it was out of the blue, as we're seeing with Oregon, for there to be a strong mutual aid foundation. So that meant that the states, for a period of time, as we're seeing now, are in competition with each other because it's a seller's market. Resources are limited. And so they're outbidding each other. And then FEMA comes in and outbids them all. So it's just sort of it's a messy phenomenon that need not be, because, you know, there are resources that the president has. Most of you will have heard about the Defense Production Act that allows the president to cap prices. President Trump has not invoked it yet, but so you're seeing a lot more competition, but also now regional coordination because they're so desperate.
Juliette, I think it's really helpful. And one of the things you were emphasizing is the normal notion of a disaster response from the federal government is you're helping one or a few states at a time. But when everybody has the same problem all at once, you know, a mutual aid process doesn't really work, in the sense that there's no more there, you know, for us to draw on, because everybody has the same challenge. And I think this is a unique event in that sense as well. Well, I think we want to go to some of the questions from the floor. So Andy, can you choose some folks for us to hear from?
Yeah, let's do that. We're going to take a question from Aditi first, and then we'll go to chat and take one from Delis. Aditi, I am unmuting you.
Great.
Juliette, thank you so much. Can you hear me?
I can. I can't see you. I guess I'm not supposed to see you. Okay, I can hear you.
Juliette, thank you so much for taking the time to be with us today. You spoke a lot about our federal government's response. And my question is that in an increasingly globalized world, to what extent can this response remain kind of at the national level? And to what extent does it need to be coordinated amongst the international community as the crisis progresses?
Oh, that's such a great question. So as I said, disasters bring out the worst in elements in two. So a pandemic is very different than most disasters. Well, because border controls actually are probably helpful. There's a big debate about them, but at some stage, let's just say a clean country, right, is going to be very wary of citizens from a not clean, in terms of the virus, country coming in. So there'll be lots of border controls happening. So this, you know, this global sort of, you know, transportation, aviation, you know, business, that's going to change significantly until my far end, which is of course the vaccine. So I think that while there's lessons learned, right? So we're learning a lot from Europe. We're learning a lot from New Zealand. We're obviously learning a lot from Asia. And there is some sharing of resources, although that's difficult at this time. So you'll hear that we get stuff from China, or we're getting stuff from other countries. This is also a very country insular incident. So countries close off borders to each other. We did to the Europe to a certain extent. We certainly did to China. And I think when we open up, that will impact us as citizens in terms of things like visa waiver. I'm not sure how that's going to work, because you're going to want visa and temperature waiver, right? I mean, there's going to be so many other concerns that a country has as we figure out what it means to open up. And the EU is going to have to deal with this as well, because you have some countries that are sort of rocking it, like Germany, and then others, Britain's still in a struggle as it comes over the curve. So stay tuned, but I think we've got 2 years of self-protection by countries as they want to make sure that someone doesn't bring it in.
Thank you for that, Juliette. There's a great question that was posed in the chat, which is, given the political complexity, federal support, state decisions, mayor involvement, where are the decisions being made and coordinated? And what information do we need? What research do we need to help with that process?
Yeah, so that's great. So don't think, and I'm stealing this from Professor Leonard, a crisis has many pieces. So it's not just one thing. So different pieces have different leads. So obviously border controls are run by a federal government. Decisions about school districts are run at the most tactical level, which is your school district or your city or potentially your state. Ideally, what we would have seen is the federal government take charge on the areas where it's particularly good at and where the states can't deal. So that's going to be border controls in that period of time that I told you between 2019 and early 2020. And I just want to be clear here. I've got very strong feelings about China's transparency. I'm not saying that it was written in stone what was about to happen. China delayed notifying the WHO of human-to-human transmission, a glaring omission for the world. But nonetheless, we did clearly have time. Test preparation kits and the distribution of test preparation kits belongs in the federal government. Communication, I think about this all the time. The shock that you felt on that day when you were told, you know what, Harvard's closing down. I bet you 30% of the university hadn't even thought about the virus the day before, right? I mean, that shock was because the communication strategy by the federal government had been, this will either pass over, it's not a big deal, rather than 6 to 8 weeks of, we've got something big company and here's coming and here's what it's going to look like. I want to raise, one of the reasons why Louisiana, some of you may be calling from there, is in such dire straits is the mayor was never notified in February of even the sort of thought process or the intelligence of canceling Mardi Gras. Mardi Gras went ahead this year, even though our intelligence apparatus knew otherwise. On the back end, I'm just going to tell you on the federal side, obviously the surging of resources, manufacturing, get us stuff and get it fast, the curbing of prices, that kind of stuff that only the federal government can do. But most of the tactical stuff can be done at the local and state level. I'm going to raise one final thing. The vaccine distribution will be a national issue. We have a system called points of distribution where there's decisions are going to be made about who goes first, generally first responders and healthcare workers, which we would think would be first. There's going to be a very, very difficult discussion this country has about who goes next.
Juliette, so very helpful observation, but another question came in the chat that was related to what you were just saying, which is about the disproportionate effect that this is having on communities of color particularly. And I think Yufern Pan posed that question. Can we open the line to Yufern?
Yeah,
and what was your question?
Go ahead, Yufern.
Hi, can you hear me?
Yes, hi.
Great. Yeah, I'd love to zone in on what you sort of glossed over earlier. As you mentioned, COVID-19 is really disproportionately affecting people of color, and this really results in some states like Chicago and Louisiana to be much more adversely affected.
Yeah.
How should the government, as well as we as a community, respond to this crisis that also comes up against the systematic racism and bias that really underlines our healthcare system today?
Yeah, I really appreciate this, and sometimes reflecting on it may not be the best answer because we do know that it's happening. I think there is legislation going through the House that will command and demand that we do have racial breakdowns by state in terms of both exposure and death so that we can have a real-time inventory of what's occurring because of not just the underlying gaps in healthcare system, but to the extent health in this country is correlated to both to immigration status, race, as well as economic status. It's just it's a painful reality, but we see that in other countries as well. Countries that have large smoking and vaping populations are getting hit, we suspect, much harder. And so there's just a lot of data that we need to compile and then make leadership aware in those cities and states that the driving of resources has to fit the need. And if the need is in those communities, that's where you drive resources. So, but without the numbers, we can't do that. So I'm seeing these numbers, they're a reflection of a much larger harm. And so I'm very much a proponent of getting that transparency so we can drive the resources to where they're most needed. And then, of course, any crisis, as we know, the spokespeople in a crisis, people who can help, must reflect the communities that they're from. A federal, me flying down to, Houma, Louisiana, to talk to the community there is not as effective as having a member of the community speak, I'm thinking about the BP oil spill. So what we also want to do is communicate to leadership in all of these communities, and in terms of what is happening, what we need to be done, and in terms of just getting basic information out. Because
so I think that too is something we've been seeing in the work that we've done through the Bloomberg Harvard program with the mayors. How much of this leadership is coming at the local level and has to be embedded in the realities of those individual communities. Andy, let's go to another question from the floor.
Yeah, there's a great question from Lily Beard. And Lily, why don't you ask the question in your own voice?
Great. That's a great question.
Hi.
Yeah.
Hi, thank you, Juliette. My question is about what counts as a crisis. Specifically, I like the way you described the slow roll crisis. It seems like there are a lot of slow roll problems we're having in this country. Examples like child hunger, mass incarceration. What is the tipping point when something becomes a crisis, and how does that change the way that administrations deal with them?
Yes. Okay, great. And this is right. So because it's remember, I don't know how old you are, but just because you call it the war on drugs doesn't make it a war, right? We use terminology simply to symbolize our interest in them, and people are calling this a war against a virus, maybe to galvanize or mobilize a population. But there are distinctions between different chronologies, I'll put it that way. And you can think about this for those of you who are going to be business leaders, right? So you have your standard operating procedures, which is just day to day, this is what's happening, and this is life, right? Then you have your emergencies, which are hopefully rare, but they're not unexpected. So, you could have a fire and you plan for that and you're dealing with that and stuff. So, for a fire department, right, a 3-alarm fire is not an emergency. It's just basically, this is what we plan for. This is true of most companies. They know, there might be disruptions of services and other things, and they've anticipated and they've trained for it and everything. Where a crisis comes in is when those, right, standard operating procedures for an emergency no longer work. So that throwing the same thing at the wall is not the solution, right? So, and you just think, oh, I just need more of it, right? And so that is, at least in terms of crisis management, that's how we think about it. So all the stuff that Professor Leonard really focuses on how do you absorb information? How do you pivot in time? How do you respond to it? And the stuff I do about who has the authority to do it in a homeland, how should we be thinking about supply chain and other issues? All of those come into play because the system itself is not holding. And so that's what, I think that's true here. I mean, I think it's a weird time to talk about COVID because in a good way, because of this sort of exceptional crisis stance that we're in, that we're all inside, like week 5, hello, that it now looks like, right, we were in a crisis, but we may avoid the worst of the crisis, right? And so that's how I think about it. You can throw the term crisis at a lot of things, a lot of social ills. I tend not to, because I think, we have an opiate epidemic, but the systems, if we can refine them and focus them, will probably be able to deal with it. And I should just end with this. I come from the counterterrorism world. I am very careful what I call terrorism for the same reason, because if you democratize it too much, it loses its value.
Julia, very helpful and a bunch of interesting questions. So if you all have additional questions, you could use the raise hand function here in Zoom. Julia, let me ask you just to expand on something you said a little bit a minute ago. There was mention made in some of the earlier conversations this morning about what we call the Stockdale Principles or Stockdale Paradox, that you have to be brutally honest about what's going on while at the same time offering a rational basis for hope. As you look around at the people who are exercising leadership in this event, who do you see doing that? Where would you draw our attention to leaders who are making a difference in that way?
Well, I mean, I think it's nothing new here. I think there's no question that Andrew Cuomo has sort of absorbed that. And he and Dutch and I have talked about this before. While his press conferences have become must-watch TV, they're actually and they look very casual and you know, where they're actually, they follow a script. And so the script is, here's where we were yesterday, here's where we are today, here's where I want to go tomorrow, and then light banter, light Italian banter, right? But that's good, right? I mean, in the sense that people are relating to him in a way that he's both governor, yesterday, today, and tomorrow, right? Tell me where I was, where I am, and where I'm going, and what we call situational awareness, right? Like my chart, position me, I'm confused, position me, where am I in this madness? And then also hope, right? I mean, a lot of drawing on New York and New York culture. And then, and then also just the charminess of, I know he's got a lot of baggage and whatever, but my sister's from New York, but he's just incredibly charming when he talks about, he's sick of the dog and his daughter's rolling his eyes at him. Like, what parent is not experiencing that right now, right? So, so I think, great. I think internationally, of course, in New Zealand, the Prime Minister is interesting, though, the politics of this and the gender aspects of this. If you look at what are arguably the six countries that in Europe and elsewhere that have, quote unquote, crushed the curve, they are all led by women, which is really interesting in Germany, New Zealand, and elsewhere. And they tend to be social democracies, which is also interesting from the politics. Someone else will study that. And so she, Jacinda, came out early. So she made a tactical decision that she was going to do stuff in the equivalent of January, February for us. She's got geography on her side. That is true, and just went straight to lockdown. And if you get a chance to see her speech, it is filled with the warmth of a mother. So it's good to play your role. You can't be something that you're not. And the we're not messing around statements of a prime minister. I will say also Boris Johnson, who's now out of the hospital, very, very controversial take at the beginning. He was going for herd immunity until he realized that that was going to cause a lot of deaths. When he pivoted and put England under lockdown, that speech, 4.5 minutes, and who would have thought Boris Johnson was probably one of the most effective speeches I've seen in this arena, because it was direct and it was him as well, right? It was, you can't not be yourself. It's him. It is hope about World War II and what London suffered during World War II and England suffered. But it is, make no mistake about it, if we don't do this, lots of people will die.
Juliette,
Julia, we have maybe one time for one more from the floor, possibly two if they're short, and then we want to give you a chance to.
Okay, I'll be quick, yes.
Dutch, very good leadership question from Bryce.
Okay, great. Oh, yeah.
So how important is continuity in leadership in crises like this? I assume it's important to have continuity, but is there like a rule of thumb on how badly somebody has to be performing before they should be replaced? Obviously, it's not always easy. Like in a democracy, you can't just vote someone you knew in, but in other, situations.
Yeah. So we assume when we practice and train, we assume everyone could die. So like, in other words, we'll like when we do what's called a tabletop, sometimes someone will walk in and kill, maybe by a hurricane or an earthquake, the governor, right? So that everyone now has to pivot, that the governor is. So I'm of the school that everyone's expendable, including me. And that's good, because you want the systems to remain intact. Now, the other side of this is if my performance is bad, or a performance is bad, what do you think about continuity? It doesn't get better over time. I have learned in my situation. In other words, that thing in the back of your head, and Dutch certainly knows probably one or two people I'm talking about, that's telling you this, they don't seem to be quite getting it, right? That this is not, that they need to pivot and lead and whatever. That doesn't change as things get worse. And so you're better off making those changes now. Now, obviously, on the political arena, you just wait for elections. And those of you who know my work, I'm not one of these people who sits around and says, if only our federal government, if only the White House did this. We deal with the crisis with the president and the White House that we have. And we figure out, how do you empower others to fill vacuums that might exist at this time? And that's why you're seeing the CEOs, and the governors and the mayors all lean in.
Adam,
I want to make sure we give you a couple of minutes to, sorry, Andy, go ahead.
Adam had his hand up for a long time. If you can
Okay,
make it quick.
Yeah.
All right, this will be real fast. I'm just curious about the resiliency.
Oh yeah, we'll get to that.
And particularly how we might overreact and how we might underreact.
That's great. Okay, let's go back to the chart, because are we ready to do our ending, Dutch?
Yeah, that's a great transitional question for us. Thank you for that.
I did leave my right of boom aspects of this because I want to end with this, because it's a great question. And I want to prepare you all. I got a lot of people on the phone, and you're all children or parents or and anywhere in between, grandparents and community members and active leaders in our society. And I think we've done terrible, or our leadership has done a terrible job of preparing you for what's about to happen. The response is the easy part. We are heading towards recovery, as I was saying before. So I want to end with this, and just, as we think about right of boom, right? I'm now, response I get, it's crazy. We're going to try to get over the curve. But now we're talking about opening up. And what does that mean? Well, whenever we decide that we open up, and how we decide, which is essentially going to be it's going to be a local, state, and personal decision, right? I mean, I don't care what my governor says. If I can't imagine going to a movie theater anytime soon, right? So there's going to be lots of personal risk calculations. What is it that we're heading to? So I'll let other people debate what the metrics are, because those are really health questions. What are we leading to? And so normally in a disaster, we talk about recovery, that the hurricane ends, the earthquake ends, it's gone, the threat is gone, and we go into recovery. We get back to normal. So think of Hurricane Sandy, right? 2 or 3 days of response, or 3 to 5 days of response, but you're almost already at recovery after that. You want people to get moving again. That's the success, right? People start moving. We are entering a stage that could be several years long. All I put under 4 is a long time, that I'm calling adaptive recovery. And it's just a different way to think about it, because we are living with the virus until a vaccine, just face it. And so it means we're going to manage around it. We're going to try to box it in. We're going to try to isolate it, shame it, do whatever we can, but we will be living with it. And so we have to think about what that adaptation means as CEOs or people involved with businesses. When do you close? What if one of your retail stores has 3 employees? This is what you get sick. This is what CEOs are doing right now. They got to figure out what their adaptive recovery looks like. Is golf going to be the new baseball, because you don't have to be near anyone? I mean, this is our life for the next 2 years. And we have to begin to think about it. It will be wearing masks. It will be I talk to people in the arts. They say, there's going to be no open museums, that likely all museums will be ticketed for a certain time. Movie theaters are unlikely to open up anytime soon. AMC is likely to file for bankruptcy. So we're going to become streaming entertainment. What does that mean for entertainment? Faith. And what does it mean for touching, which is such a huge part of faith? What about dating? I mean, I've been married a long time, but what's a hug, right? I mean, what's a hug now? And thinking about how our life will be different. I don't say this with joy or anything, just it is what it is. And this is where we're heading, is this adaptive recovery. I'll end with this. Everyone says the new normal, or some businesses talk about the next normal. Honestly, I don't know about you. I talk about the now normal. I talk about today, because I don't know what tomorrow's like, and I won't. And it's the only way that I can ground this, because if I just realize that for the next 2 years, things will seem more normal. We won't be inside, but they won't be like they were in 2019, and they might not be after we get the vaccine. And then once we get the vaccine, then we think about, my God, is there a better way to do this? Or what were those things that we saw that were so flagrantly awful? that we need systems to protect people, much like the Depression did for the new, in leading us to thinking about a social contract that helped all, or at least tried to help all. And those will come as well. I honestly believe that, but we've got, as I say in number 4, a long time of the now normal of this adaptive recovery stage. So Dutch, but it's good news.
Juliette, I want to just build on exactly what you just said. So a short message to all the RCs, the ECs, the whole community, the alums who are with us today. And it just builds directly on what you just said. It's about the word resilient. I want to emphasize that resilient is not something that you are, it's something that you do. And what you do is you engage in ingenious, creative, agile, rapid problem solving with all the problems that we haven't seen before. Just what Juliette was just talking about. We got to reinvent the way entertainment's going to work, because we have to invent, came up in the last session as well with Dr. Ashish Shah, we have to invent a new economy that operates in the presence of COVID-19. That's the reality. And so how do we go about doing that? Well, what I want to suggest to you all is that COVID-19 is your latest, greatest, most global, most difficult, and probably most important live HBS case study that we are all living through and solving our way through. Think about this for a second. Think about it in terms of case studies. You don't have all the facts. Some of the facts that you have now are going to change. So things are going to be different. And there's no one in the room who can give you an answer to this. And so we have to figure it out together going forward. Doesn't that sound like every case study you've ever done? You have to figure it out. You have to be willing to try stuff without knowing whether it's going to work. You have to see how it works. You can't just guess, and you can't just sit on the side and hope for it. You got to do it. And you have to keep doing that over and over and over again. So my message to you all, follow Juliette's lead. She has done this repeatedly and famously in a bunch in which she has helped us to figure out how to make our way forward. Not everything worked, but enough of it worked that we could find our way, and we kept getting better as we went. And that's what we're going to do here. So in these disrupted circumstances that we're in, there's also great opportunity for us to rethink things that we did before and to prepare for whatever is coming. As Juliette says, the today normal. Yeah. I want to say to you, you all have been preparing this for your whole life. This is a moment of destiny for all of us. Your skills are needed right now, and they have never been more needed. We're going to go forward, we're going to renew, we're going to rebuild, we're going to reinvent. But more than that, we're going to build new things. We're going to imagine new and different things than we've ever had before. We have to invent the post-COVID-19 world. And no one is going to be better at that than this community is, than you all are. That with your ingenuity, your skills, your problem-solving skills, your HBS case study background. So my message to you is go forth from this place and time. Not yet, because there's some more things to do this afternoon in the symposium, but go forth from this place and time and engage in the kind of leadership that Juliette has demonstrated throughout her career, and that all of us need. It's leadership that makes a difference in the world. We're counting on you. That's our message, and we're sticking with it. Juliette, I know I speak for everyone who's here with us today, that we're so grateful that you could take this time and be with us. And thank you for your leadership on all these prior events and all the good work you will yet do.
Thank you.